I've been in Fiji for 5 years, and the most significant complication of lupus is what we call lupus nephritis. So it's kidney disease relating to lupus. So I came to Fiji as a kidney specialist, and so the medical physicians in Fiji who manage patients with lupus, when their patient experiences lupus nephritis or has signs of lupus nephritis, of kidney disease from lupus, they will refer patients to our service and to my clinic. So my experience in these last 5 years is that even from the beginning, in my first few months, I noticed that there was quite a significant number of patients that were being referred, more than my experience in Australia. And so it's become, although a small group, it's a significant group because these are young people who have this disease suddenly come onto them, and without the right treatment can have quite dire consequences. There's a high rate of kidney failure and even death if the disease is not managed correctly and treated correctly. We've had, well, the pediatric department has patients with lupus, so that they can be very young in early childhood diagnosed with lupus, and I've gone all the way until 40s, 50s, 60s year old patients with lupus. But most commonly lupus affects sort of young teens to older teens into early 20s and 30s. The most severe cases I've seen, unfortunately, I've had a number of patients who have developed kidney failure and died from the disease. And it's heartbreaking when it's really young patients. But I mean, death in anyone is difficult, but especially seeing young children or young adults experience a very difficult disease and have a very poor outcome. So there's two things. One is that I think it's just getting a little bit better recognized in the last 5, 10, 15, 20 years in Fiji and also internationally. So there is a higher rate. But Fiji in particular, compared to other reports internationally, Fiji has a high incidence. So it's a higher rate of new cases compared to international, other countries. So even worldwide, we're still learning to understand what causes lupus. We think it's a mix of having a genetic predisposition, so there's something in the genes that make some people more susceptible than other population groups. So I think that the Itoke and the Indo-Fijian community have some higher genetic predisposition compared to Caucasian populations or other populations around the world. And we know that that's the case. It's well described in other countries, that there are other certain groups that have a higher incidence. There's also thought to be some environmental trigger, and as of yet, internationally and in the medical literature, it's not understood what those triggers are. So I don't have anything more to add to that, but I would say that the Itoke population and the Indo-Fijian population seem to be at a higher risk compared to maybe other groups of people, and so we need to be more vigilant about identifying and screening in patients that present with symptoms that could be lupus. So across the world, 90% or more of the cases are in females. Again, there's some theories as to why it affects females markedly more than males, but to my understanding, there isn't anything definitive yet. It may well relate to, again, genetic predisposition or some hormonal changes in females that are not present in males, but males can develop lupus, and when it does develop in males, it often tends to be a more aggressive, severe disease, unfortunately. Most of the care is provided in the public sector. So from diagnosis to treatment, we do have access to treatments now in the public sector. Historically, when I first arrived, even 5 years ago, there were limits to what we had available through Ministry of Health, but in the last few years, we've been able to place some of the core treatments on the essential drug list in Fiji, so it should be available for free now. So treatments are available, and they are free without any cost. There are still some limitations with some of our diagnostic tests in the hospital, but it's being actively worked through to try and get it more available. So there has been advancements in the last few years, and now there shouldn't be any limitations in terms of patients' cost to get diagnosed and to get treated. So that's not a problem just for Fiji. Worldwide, it's recognized that lupus there's a delay of the onset of symptoms and the ultimate diagnosis of lupus, sometimes in several months, as you say. And that's partly because the symptoms can be subtle and difficult to pinpoint as to what the underlying problem is. The only way to address that, I think, is just a general increase in awareness in the public that this is a condition, that it's more common in Fiji than elsewhere. So if you're a young person, especially a young female, and you have some symptoms or problems that doctors can't seem to pinpoint, then it could well be lupus, and you should ask your doctor to test for it. And there also needs to be an increasing awareness amongst the doctors in the primary care and even the specialists, but especially the primary care that have that first interaction with the patient to think about this problem. So there are efforts, especially with Dr. Kumar that we spoke about, to do some education sessions with primary care doctors. These are planned for later this year, to just put it in the forefront of their minds, so they think of it earlier, not wait down the line while the disease is getting worse to finally think about it and to send off the tests. I would say that, this is more of a message for people who have had lupus or who know people who have lupus and supporting them, that it's a difficult disease to go through and that any assistance that you can provide these people is of great help from both a family perspective and a community perspective. Sometimes these women or these young people have to feel like they need to go through it alone, or they even face barriers and difficulties even within families of getting access to treatment. I've had a number of patients who want to pursue treatment or understand that it's serious, but some of the senior family members want to try more natural treatment and herbal treatment, and it always ends badly. So to be aware that this condition is serious, that it needs medical attention, it needs strict follow-up and sometimes some significant treatments, and any support that you can lend people with lupus is appreciated.